We have a set of questions around healthcare, and I know that's definitely, you can't talk about the economy without talking about healthcare, whether in a global, national, or local standpoint. Your views on healthcare, the impact of healthcare on the economy, and how do we make it really a positive impact versus a seemingly drag on the economy as we've had?
Well, we're getting into a pattern here. I'll start off. I mean, healthcare is a huge part of the economy. One of the questions people often ask about the first year of the Obama administration, why did you take on healthcare at the same time we were having all of these other issues? And I think precisely the reason was healthcare is not just a huge moral, social, all the, technological issue. It's an economic issue. And it was one of those that we thought by helping to deal with that, it's something that can be helpful for the economy going forward. If you ask, how can it, what's a positive on healthcare? You ask, how's the economy doing? What's the sector in the economy that is growing, that's adding jobs, that was adding jobs through the whole recession? It's the healthcare sector of the economy. I think it is, and that's, I think, partly because it's a dynamic sector coming up with incredible innovations, the amount of exciting discoveries that are looming on the horizon, I think, are perhaps bigger in healthcare than in, so many parts of the economy. So that's the positive. The hard side is it's a complicated side. Precisely the reason we don't leave healthcare just to the private sector is because it's complicated. We don't look at someone who's on the street and in distress and say, sorry, you don't have health insurance, you should have bought it, and so too bad for you, right? We as a society are going to take care of that person. That inherently puts the government in this position. So I think we, through the health reform legislation, I think it was an incredibly important step. I think it's a lot like dodd-frank in that the basic framework, I think, was sound. It had good, was in consultation with industry, with consumers, with doctors. And the devil's going to be in the details. We are in this 2013 is an incredibly consequential year for how we actually ramp this thing up. All of the regulations that go in, the insurance exchanges so that people will have a place to buy insurance at the start of 2014. That's going to be a huge thing to be implementing over the next year. And it's one that the implementation has to be done well. I think that is incredibly important.
Okay, so my guess is probably every person in this room is spending a lot more on mobile telecommunication services than they did a decade ago. But we probably all think that that's worth it. In fact, we've all made that decision in our own lives that the added benefits of having a smartphone or an iPad or whatever are worth the added amount that we spend. On the healthcare side, you got to make sure that you're defining the problem correctly. And on the healthcare side, what we have are unsustainable healthcare cost growth, which is driving three symptoms. It's driving slow growth in wages because employers are spending more of compensation increases on covering health insurance premiums and less on wage growth. Two is it has meant that there has been a large number of uninsured because as the product gets more expensive, fewer people can afford to buy it. And then third is that it's bankrupting state and federal governments. And so the problem, the way I would define it is that the problem, and by the way, President Obama got this correct. He did not define the problem as we have too many uninsured. He defined the problem as unsustainable healthcare cost growth, leading to all three of those symptoms. I wrote at the time, kudos to the president for diagnosing the problem correctly. And then I strongly disagreed with his solution, which was we're going to expand a government-financed benefit to a whole bunch of people, and then hope that increased government intervention in private sector healthcare is in fact going to result in slowing cost growth. We got the expansion of access, or we're getting the expansion of access, by the way, mostly through Medicaid, even more than through private insurance. We've gotten that, and so those costs are now built into the system. What we have not got is any kind of certainty that in fact healthcare cost growth is going to slow. And in fact, what history suggests is that the more you move the payment for medical goods and services to a third party, the more that gets spent. This has been true With the creation of Medicare and Medicaid, it clearly helped the people who are enrolled in those programs, but it also increased both the level and the growth rate of spending, and it's true in private insurance as well. So my fear here is that we've expanded access, but if anything, we've probably exacerbated the unsustainable growth in per capita healthcare. I happen to think that instead the way to go is to push the decisions more to the people who are in fact receiving the goods and services. It's to move more toward consumer-directed healthcare, initially for routine services, and then people can start to make trade-offs and figure out, am I in fact getting good value for the dollar that's spent? Is this additional test worth the cost? Because that's what you really want. You don't want more spending or less spending. You want high value spending. You want to be saying, I'm getting a lot of health benefit for this dollar.